Hi, my name is Sarah DeJulia, and I am going to inform you about suicide in America. Suicide has increased through the past years, increasingly in teenagers and young adults. On average of one person every 13.7 minutes, someone killed themselves. On average of one old person every 1 hour and 28 minutes killed themselves. An average of one young person every 1 hour and 54 minutes killed themselves. Suicide is the 10th ranking cause of death in the United States, and third for young adults and teenagers. This is a death that can be prevented by 100% by offering help to those who want to give up on life and feel as though they can't go on. It is horrible that people look at suicide as an option to end their hurt and pain they are dealing with, rather than looking to God or seeking treatment, and realizing that they are not alone. I have experienced depression and I know how powerful it can be. With that being said, suicide prevention is something dear to my heart and something that needs to be well known to citizens of America because even a smile could keep someone from wanting to commit suicide they had planned for that day or even that year. Although there are many reasons for why teenagers and young adults and old adults commit suicide, bullying is ranked as the highest cause for wanting to commit suicide. If we informed people more about suicide awareness and informed people about how bullying affects people, we could lower the suicide rate tremendously. Raising the consequences and having teachers emphasize the consequences of bullying will hopefully drop the rate of kids who are bullied every day at schools. What is depression? Depression is when people feel hopeless and out of touch with life and their current emotions, which often leads to suicide. Social media is one of the main reasons for why depression hits home. Through social media, we are looking at things, we are seeing things, pictures of how girls or boys are supposed to look as models or a perfect relationship, rather than going out in the world and actually socializing with each other and communicating in person. There are social networks where people are allowed to ask anonymously whatever they want, and sometimes through bullying they can do that, which causes someone to be depressed and lead to suicide most of the time. Another cause of depression could be hormone imbalance, in which this case, hormones are imbalanced and it causes something in the brain to not work right. For this, there is medication. Another result of depression or cause is surroundings and social situations. Surroundings like the season you're in, or just the type of situation, as in a funeral or a concert or even at school. Most of the time, when people go to school, they don't realize how much anxiety it can build up for someone who's an introvert or somebody who is being bullied at school. That anxiety can cause someone to go into deep depression and make them not want to go to school. Regression analysis revealed that increased media multitasking was associated with higher depression and social anxiety symptoms. Even after controlling for overall media use and the personality traits of neuroticism and extroversion, suicide rates in the state of America in 2009 were examined for their association with volume on Google for commit suicide, how to suicide, and suicide prevention. The results were suicide rates for the 50 American states were positively associated with the research volume for all three terms. The conclusions were internet searches for suicide may provide a faster way of monitoring possible trends in suicide than waiting for central governments to compile suicide statistics. A review found 25 studies linking insomnia and sleep difficulties to an increase in suicide. The review that found 25 studies linking insomnia and sleep difficulties found that it increased suicidal tendencies, suicidal behavior, and death by suicide. Sleep problems are associated with both depressive and anxiety disorders, both of which are risk factors for suicide over-arousal marked by agitation and sleep disturbances. Mainly insomnia and nightmares is often experienced by suicide victims immediately prior to death. Therefore, many people feel as though there is no way out from the hurt and pain they are struggling with. But there is a way. With knowing the statistics and causes of suicide, we can help create awareness and decrease the numbers in suicide. So many teenagers are being told by society that they have to look a certain way or be a certain person in order to succeed or be perfect. In life, however, that is not the case. One can be whoever they want to be. No one should feel pressured into being someone they aren't. I can recall many times in my life when I wanted to give up. But through my faith and encouragement from others around me, I chose to keep living. If we can show those who think about suicide or attempted suicide that there is hope, we can change the statistics and help each other out in the process. Thank you for watching.